Okay, Alison, for now, thank you. Well, let's put the politics of it to one side and get back to the science. We can talk now to Dr. Primrose Freeston, who's an Associate Professor in Clinical Microbiology at the University of Leicester. Dr. Freeston, good to talk to you. Broadly speaking, do you welcome this decision?
Yes, I do indeed. Coronavirus, COVID-19, is still out there within the population. The virus hasn't gone away, and while shops have been open, the fact is the virus is still there. It passes from person to person. Without a human host, the virus just doesn't reproduce. So wearing masks, socially distancing, hand sanitisation, all of that deny the virus the opportunity to get inside you and me.
So why then do you think that it hasn't happened already? Has the science changed so widely in the last month or two?
Well, the issue of the virus passing from person to person, that's been understood. When you cough, sneeze, talk, sing, sort of saliva, your breath is actually projected at force from your body. Okay, and if you're close enough to a person, they can inhale respiratory droplets, you know, mucus, saliva, whatever that you've actually coughed, sneezed, or whatever out. But more recently, science research has actually shown that the virus can actually persist in aerosols. Now, aerosols are sort of little air currents within doors, okay. So if you've ever looked at sort of sunlight through a window and seen those little dust motes, that is basically an aerosol. And there's been experiments now which the World Health Organization has been following, which shows the virus can persist in an infective form for up to an hour in these aerosols. Now, why is that relevant? Well, in shops, small shops especially, where there's no air conditioning, you can have these aerosols around for a while. Wearing the mask helps you to actually stop releasing the virus in the first place, and it not only protects other people, it protects you too eventually.